Dr. Mikayel. I'm Mike Abramyan, and we're pediatricians at Pediatric Associates Medical Group in Sherman Oaks. So we first wanted to, chat a little bit about the first, minutes, seconds of life of your newborn baby, and so what happens when the baby's born?
Yeah, so when the baby's born, the OBGYN, right, takes the baby, hands it usually to the nurse, and the nurse takes the baby to the warmer, right? And at the warmer, the nurse assesses the baby and make sure the baby's vigorous and grimacing and breathing and crying, and stimulate the baby breathing. And you could see they're rubbing the baby, and the baby starts crying and looks good. And sometimes they have a pediatrician there, right? Sometimes if there's there might be issues, they call the team to come in
and not usually even just issues, but more just as a precaution.
Yeah, some places have the pediatric residents there, right? And you might see another doctor in the room.
Sometimes they're just there to learn too.
Sometimes they're there to learn.
Yeah.
Sometimes it's a precautionary thing. You're right. They have the NICU team, maybe like a nurse or a respiratory technician who's there just in case. Depends on various factors.
But most of the time, it's just like you're saying, Mike. It's just very routine. All those things about checking the baby happens in a matter of seconds.
Yeah.
And then the nurse will hand the baby back to you.
Yeah.
And everybody's very happy.
Yeah. There were delayed cold clamping. People ask about that, right? We kind of skipped over that. What happens?
Yeah.
But they usually about a minute
up to
or
60
so.
seconds.
60 seconds, right?
Yeah.
They delay the cord. You want to make sure that the blood from the placenta is being pumped to the baby. The baby gets a lot of stuff, a lot of blood, which they'll need in the future. What about cord cutting, right? That's another one.
Yeah,
people ask about.
That's often something that's very fun for some people, given to the partner if they want to, and not all partners want to. And if you don't want to, that's okay. There's plenty of people who will be willing to cut the cord. And happy to do it for you. You don't have to worry about cutting it perfectly. It's going to dry up and fall off in a matter of a week or two anyway.
Yeah.
And then everybody always asks about like skin to skin.
Yeah, skin to skin, very important, right? I think imprinting is we see it on all the animals. I think human beings probably the same thing. There's various studies showing that skin to skin is so important to get the baby right away to the mom, and for mom to have that connection, including the mom, right? There's studies on moms. If they did that, they tend to be more attentive, and and the baby's taken care of better. So skin to skin happens, and then we encourage also the breastfeeding, right? It's like by the breast and latch the baby as soon as you can. And some moms might have issues, right? Like sometimes if there's C-section, sometimes they won't get that. Because they need to operate and they need to close up, and you're draped and you can't get that, but they certainly try to bring the baby close to the mom and hang out there with dad. Dad holds the baby and close to the mom, and that's how they kind of bond, right?
Yeah, and then once the mom is stabilized, everybody's doing well. You're in an actual room instead of the delivery room, and you're in a much cleaner, nicer, hopefully a little bit more comfortable room. Then the baby will stay with you for at least the next 24 hours. So walking you through the next 24 hours, a lot of people ask, well, when does the pediatrician come in? Sometimes we get a phone call. When have you guys, do you guys know we had a baby? Please come now.
Yeah, it's true. We show up within 24 hours. You're supposed to show up within 24 hours, assess the baby. If we can't make it, there are many doctors there neonatologists, fellows, residents that can do the same thing for you, other pediatricians. But the baby needs to be assessed within 24 hours. We get that phone call in the middle of the night, don't we?
Yeah.
You have a newborn.
Right. And so routinely for, private practice pediatricians, hospitalist pediatricians, we'll do our rounding in the morning, kind of like at 6 or 7. That's usually when the hospital things kind of move along for the rest of the day. Yeah. And then, a lot of people ask us, what do you look at when you look at a baby, and how do you know if a baby's okay?
Yeah. That first assessment is done by the nurses many times, right? Because you don't really have a doctor there all the time. You don't need to. Even the residents sometimes do that, but you still need attending physician, the experienced physician who's board certified to do that for you. It's the first physical. What do you do during that physical when you come into the room?
Yeah, basically check the baby head to toe, literally head to toe, just like we do for any pediatric physical exam. It's very important, especially for the newborn exam, to make sure the head, everything's doing well. It's very normal for especially a vaginal delivery to have a little bit of misshapenness to the head, and that's perfectly fine. Sometimes there's a little bruising. Don't be alarmed with any of that type of stuff. Very common, very normal, very expected, and resolves within like the first week or two typically. And then from there, looking at eyes, nose, ears, mouth, everything, making sure that there's a good suck reflex. Babies have a bunch of newborn reflexes. One of the most important ones to feed is to have a good suck reflex. And
very good assessment, right? It's a very good neurological assessment.
We could go down the whole list. I don't want to bore you to death.
Yeah.
We literally check head to toe.
Yeah, every little thing, and sometimes I think when I do it, sometimes the patients go like, that was quick, but I think we've done it so much, you could like really get a lot. Just like when we look at the eyes, there's so many things we look at, how open they are, the iris, the reflexes, is there blood in there, the spacing of the eyes, the slanting of the eyes. Anything else I'm missing on that? There's a lot of stuff, and that's just eyes.
Yeah, right? I got asked today, there's this little bit of redness next to the iris, and that's something that is sometimes easy to miss in the initial exam. We don't focus too much about that. Just having a tiny little capillary bleed in the not to scare anybody. Yeah. Very, very common just from being squeezed, and harmless. But we're mainly looking at the back of the eye, the retina, and making sure that looks healthy.
So basically just that was like an example of just one thing that we quickly, it takes us maybe like a second to look at the eye, but it's like a quick assessment. So we look at everything, the hair to toes. I mean, like, one time when I started, I almost missed like the extra toe.
Oh,
yeah, because it's like from now on, I'm going to start counting, because like 5 and 6 is kind of similar.
Right. Yeah. And sometimes the extra toe looks so much like a normal toe. Like, well, everybody should have 6 toes.
Yeah. I was just looking at the baby and I was like, wait a minute, is that extra toe? And I was like, 1, 2, 3, 4, 5, 6. It's an extra toe.
Right.
So I count the hands and the fingers and toes.
I need to start counting as well. Yeah, can't always just
just looking at like
pattern recognition. Yeah.
Yeah.
But yeah, moving on, and of course we take all these little details very, very seriously.
Yeah.
One of the questions we always get asked about is about the things that the newborns receive, like should they get the hepatitis B vaccine, should they get the vitamin K injection?
Yeah. I mean, I guess there's I think amongst the doctors, right? I don't think there's controversy. I think hepatitis B, vitamin K, important things to do. I think for population, for United States, many women I know in Long Beach when I did my a lot of my rotations, Male Children's Hospital, we had many women who would come in with bleeding and didn't know they were pregnant or they're having a baby.
Wow.
And they had no care, they had no prenatal care.
That's scary.
So for those women, we had to give the hepatitis B shot, wait for the check, if they're positive or negative for hepatitis B, and then give additional HBIG, right, if they're positive. But I think for the population, hepatitis B is good, right? It's a good policy, right?
Definitely for population health, it's good.
Yeah.
Obviously, there's some debate about the importance for women who know their hepatitis B status. It is part of the routine testing, and that's definitely a conversation you can have with your OBGYN and your pediatrician about whether it's the right for you to do immediately after birth. Or it's something that can wait.
Right. And the other wrinkle is that I know, talking to infectious disease doctors too, that we have to trust women that they did not have exposure after testing, right? Many times you'll do it, and what if a spouse came down with hepatitis B before that, or they were with somebody who had hepatitis B extramaritally, right? So these things can happen, and not everyone's married, so there is all these things that women don't know if they're exposed to it or not. But if you've not been exposed to it and you're hepatitis B negative, yes, there's no reason, I think.
Yeah, I mean, if theoretically, if we could be 100% sure that a woman doesn't have hepatitis B, then there's no risk to transmit hepatitis B to the baby. And so absolutely, in that case, it can be given at a later date.
Yeah. And vitamin K.
Yeah, vitamin K is absolutely 100% important. So babies are born with low levels of vitamin K. They're also at a slightly higher risk, of having some bleeding. And some of that's like I mentioned about, a tiny bit of blood vessel being popped in the eye occasionally. And this is, none of this is to scare anybody. This is just routine stuff. There can be a little bit of bleeding in the brain. And so having the vitamin K injection to supplement that will prevent any, severe hemorrhage in the brain. Which is very, very important to receive that vitamin K.
We used to have problems with umbilicals, right?
Oh, true.
That was the thing. People would go home and babies would bleed when their umbilicals came off, right? And then we had this issue with newborns. But after vitamin K, that basically is never seen. We sometimes see people call it like there is some blood, right?
But usually that's like some dried blood that gets wet from the urine or something else like that. Definitely important to get the vitamin K injection to prevent any catastrophic bleeding in the brain or elsewhere in the body. What about moving on to probably one of our favorite topics and the favorite topic of a lot of our expecting moms is breastfeeding.
Yeah, breastfeeding was the slogan, breast is best.
Breast is best, and then the corollary to that is definitely fed is best.
That's true. Calories and fluids take precedence, right? But it is not uncommon to see babies lose weight, right? They come pre-built with a lot of fluid.
Yes.
And they may lose up to 10%.
Right, and that's just weight. From peeing. Peeing and just being alive, babies will lose up to 10% of their body weight in the first day or two. So nothing to be alarmed about. They'll be checking the weight. They'll be letting you know about the status of the weight over the time of the nursery course. And based on that, maybe make some decisions about how best to feed What's your advice usually for women who are talking about breastfeeding and nervous about that process?
Yeah, I think going through it, been there for a bit. I think breastfeeding is not as easy, and I think for women it's almost like fish size and fishermen. It's always like the fish size gets bigger and bigger every time they speak about their catch.
Yeah.
And I think breastfeeding is the same, and it's like I think it starts off like I had some trouble the first week, and then it's like some things like 3 days, and it's like, no, I put the baby, the breast in the mouth, and the baby went crazy, and we had no problem. I think that's what happens.
Sure.
But I think most women, we see that. I mean, most women have some serious issues breastfeeding.
And so the issue isn't like anything that terribly concerning as far as
or abnormal.
Right. It's more just basically how to latch a baby on, how deep should the latch be, and oftentimes it's something
pain,
right? That too.
They're not used to pain. And a lot of women, I don't think they know that it's okay to experience a little pain. At first it's normal. Yeah. It should be transient. It should be tolerable, right? And it should get better over the few days. But if you're having more issues, more than that, then you need to see lactation. You need to see OB or
sure, right.
Pediatrician.
But then the most important thing in the hospital, the nurses there, super experienced with supporting breastfeeding, and then they always have a lactation consultant. We'll see you sometimes at like a very odd hour of the day or night.
Yeah, that's true.
But all of these lovely women in the hospital, very, very willing to help you latch the baby, get the most comfortable hold position. They talk about like the football hold. I forget all the other names of the different types of holds. And then the most important thing to realize about breastfeeding is that, the latch is like 90%. And then the rest of it is just waiting for the milk to come in.
Yeah.
So
I think I tell moms that there's basically a few prerequisites, I think, for you to make breast milk, right? You have to have a baby that is strong,
sure,
right? You need the suck, you need the demand,
yes,
right? And so that's the demand side. The supply side, you need to make sure that you have calories.
Yes.
The mom has calories, is eating fluids. You need to be hydrated, right? Pain. If you're in pain, your body's not going to make breast milk.
Yeah.
You need so some women, I think, especially with C-section or even vaginal, when they have a difficult time, they're troopers. They don't want to take pain meds. They don't want to spoil, they mess up the milk, and they're just being, courageous and just trying to deal with the pain. But the pain will prevent the breast milk production.
Yeah, if a woman's body is under tremendous stress, it makes it very challenging to appropriately breastfeed.
Sleep.
Yeah.
Right?
Like
so many women go through this process. They have long labors, they're uncomfortable, they're not sleeping, they're in pain. And then hospital is a horrible place to sleep for anyone.
Yeah.
For the doctors or for the residents, and for moms too. So you need to make sure that you're comfortable, you're sleeping, you're rested, and you're latching the baby on pretty frequently. You have to latch the baby frequently, 1.5 to 3 hours. That's what usually, right?
Yeah.
That's what.
And then to ultimately just be patient with yourself and with the baby, because the milk, we always say, doesn't really truly come in per se until about 4 or 5 days.
Yeah.
For
first C-section, definitely first timers, definitely breast. Vaginal birth, if you have a pretty nice, uneventful vaginal birth, I think 2-3 days, it starts coming in, right?
But the early production, even on day one, initial latch, you'll have some colostrum.
Yeah, very important.
Yes.
Yeah, talk about colostrum. I think that's
is very nutrient rich.
You could get it at O1.
Oh no, okay.
Human, but that's that important that you could get these things at
Don't give Erewhon colostrum to your baby.
No, but it's cow colostrum, but human colostrum.
Yes, but human colostrum is very fat rich. It's very, very calorie dense, not very water rich. So it's not very
It has it's very dense. Right?
Yes.
It looks super yellow, right? It has a lot of things in there, right?
Lots of vitamins, lots of minerals,
right.
lots of antibodies.
Antibodies, right? And this is the fascinating thing is that your gap junctions in your gut are pretty open the first few weeks, and then when you take in that stuff goes in there. Usually it doesn't, because they close up, and then it's pretty safe. But the antibodies that you give to your baby, that first few days, they go in.
It's amazing how rich the colostrum is. So don't discount it. It's a very small quantity, but packs in a really good punch. And then it's just a slow day-by-day increase of the milk supply. It'll get a little bit thinner, a little bit more milk-like, until about day 3, 4, 5, when it's fully in, and things are hopefully a lot more smoother then. If the baby wants a lot more milk, and moving on to our next topic about jaundice, maybe we should go into that a little bit.
I think the other thing, maybe just talk about the baby the first day or two.
Oh, sure.
Yeah, how they act, and that can vary, right? So what would parents expect of the baby the first day or 2 or 3?
Yeah, so the first couple days of life of the newborn baby, it's not like a baby that you would see on a Pampers commercial. The baby looks like something that came freshly from your womb, and the baby is going to be just a lot of crying and a lot of sleeping, and just a lot of trying to basically eat, cry, sleep. Not a whole lot of other type of interaction. There will be a lot of reflexes in play still. But don't expect a smiling, cheerful, chubby-cheeked baby the first couple days.
I think it's like what to expect. I think it also depends, right? The first day you'd see some babies are super fussy.
Right.
Sometimes babies, if they go through difficult birth, sometimes they're just passed out.
Yeah.
They're exhausted.
Very true.
They don't want to eat. C-section babies, they swallow so much fluid when they're being taken out, and then they're spitting up all the time, and they don't want to eat. They don't want to feed. That also happens.
And we really don't expect a baby in their first 24 hours to really want to eat anything. That's just not
We just want them close to you to start smelling you and start suctioning a little bit,
Right.
But I think the first day to 3, it's a gamble what you get, right? And doesn't mean necessarily that that's what your baby's gonna be like.
Right.
But I think the important thing is that you need to have the baby by you every 1.5 to 3 hours, and then you need to listen to the nurses, because they've been doing this for a long time, and they know what your baby looks like and what they need, and they will guide you.
Yeah, absolutely. And definitely important to build that village. So I mean, let's kind of talk about the things to be done before the baby can leave the hospital, and maybe coming back to jaundice.
I think the pooping, right? That's the first.
Sure.
Yeah, you need the baby to poop and pee the first 24 hours. That's important.
And basically what that really means for us is that they're able to do that.
Right.
Because as humans we have to pee and poop.
Yeah.
And so we want to make sure that they're able to do that before you go home.
Yeah. The jaundice. When does the jaundice start?
So basically, jaundice is yellowing of the skin. That's what we call jaundice. It starts on the face, and if the level increases, it goes down the whole body. It starts at 24 hours of life. And basically what it is the fetal red blood cells, red blood cells that the baby had in the womb, are being discarded, being reprocessed, and making way for
repurposed.
Yes, repurposed. Yeah, and being making way for new, like, normal, healthy, regular red blood cells for babies. And so those fetal red blood cells, the hemoglobin inside them, the oxygen carrying giant molecule, breaks down into for bilirubins, and the bilirubin is the level in the lab that you would check to see how the jaundice is. Every baby has some jaundice. Every baby has a little bit of yellowing in the eyes or the face. And our only goal is to just make sure that bilirubin level doesn't go up to 30, which you don't have to worry anything about right now. Obviously, your pediatrician, your nurse, your friends, your parents will keep an eye out for that type of stuff for you. The most important thing for jaundice is just making sure the baby is eating and pooping, because pooping is the best way to get rid of any jaundice in the blood, any bilirubin in the blood. There's some risk factors that we would check for to see if there's any increased risk of having elevated jaundice, or more risk of higher levels of bilirubin. But we don't need to get into the weeds of that right now either.
Yeah.
As far as the jaundice, nothing to really worry about. This is not a new thing. This is a very routine thing that's done. Every baby gets checked for jaundice at 24 hours of life as well. That's another part of the checklist to go home.
And a few things about bilirubin, the level also kind of matters. So it's like also if the baby's really small or preemie, that you might see that they might try to treat earlier, right? And the treatment and the check is actually nowadays is pretty nice, because it's a skin test,
right?
And then if it's elevated, they do the blood test, which is they prick the heel, and sometimes parents get really concerned about that. It's like, oh my God, she got poked 4 times. Look at their heel. They heal very quickly, babies. But sometimes they have to be poked, and if it's really high, then we put them under phototherapy in the hospital, right? And we follow that when they come home.
But just rest assured that the jaundice is something that's not new to any of us who are working and dealing with babies, and not anything that you need to worry about. Right. Most important thing is to feed well. And so that kind of goes back to what I was alluding to a little bit with the breastfeeding, is that sometimes if the jaundice level is a little higher for any reason, and sometimes just because of some of those risk factors, then we would recommend to supplement rather than just doing exclusively breastfeeding. And so it is totally fine, and sometimes very important to give some formula in the first couple of days of life.
I think many times when the physicians are giving advice, maybe we're not as clear, and we in our minds we know what it is, and we don't explain as well. And I think the parents have to be kind of advocates, because we sometimes forget, and we meet all kinds of different people, and it's difficult to just like say the same thing all the time, different ways. So I think if you feel uncomfortable or wondering what's going on, you should definitely be able to talk or speak with your provider and ask them, why would you do this, and why is this happening, and what are the alternatives. I think it's a great thing to do with anything. Just ask, what are the alternatives, what are the risks, and then you'll see that your provider was basically giving you advice out of the goodness of their heart, and making sure that your baby and you are safe. Right?
Definitely ask all the questions you need. We'll have some time for questions in a little bit too. As far as once we've checked all these things at 24 hours, there's a couple other tests that
let's talk about the tests that they do, right? So the bilirubin is one of them. What are some other tests?
We'll do a hearing test. Every baby gets a hearing test. It's kind of always interesting. I still don't understand the technicals of how they can check a baby's hearing when they're just born, some type of electrical signals, which is pretty awesome to me. And they'll check both ears. very dark, quiet room.
Yeah.
And we'll let you know the test results right away. And
it happens after 24 hours, right?
Just to make sure that the ears are nice and dry.
Yeah. We have some people that don't pass.
Yeah.
And that's okay. Many babies, they just go after 2 weeks, 3 weeks, and then get retested, and they're fine.
Yeah.
So don't be alarmed if your baby doesn't pass the test on one side.
And the other stuff we test, we check probably nobody will even mention this, that it's an actual test, but they'll check the oxygen level.
Yeah.
One hand and 1 foot, just to make sure.
It's a great test.
It is a very
very inexpensive, high yield. I'm glad they implemented that.
For sure.
Cardiologists have been asking for it for a long time. It's an oxygen level in the finger and the toe, and they should be pretty much the same. And if they're not, then that might mean there's some issues.
I haven't, heard of any baby that hasn't passed that test.
Yeah, I think the fetal echoes pick it up.
Right.
Like basically you're looking for structural defects in the heart, and then if you do have like a good echo.
Thank goodness for the OBGYNs. They're making our job so much easier.
Yeah. It's good. There are no surprises anymore.
Right.
Thank goodness.
Well, after that, pretty much the pediatrician and the nursing staff in the hospital
But the newborn screen, right?
That's true. Yeah.
The newborn screen is one of them.
Every baby gets pricked for that. In the heel for
it's different in every state.
Oh, really?
Yeah. California has more. Well, they all have it, but it's not. Every state is as much.
I thought you were meaning the prick is different.
No, sorry. The screening test, right? Like what they're testing for is different. California, we pay a lot of taxes, and therefore we get this huge panel.
It's a very good test.
Yeah, it's there's no surprises.
Yeah. So for that test, you won't get the results for like 3 weeks.
And they're stored somewhere.
Right. Absolutely. And the pediatrician will receive those results. And go over anything that needs to be further reviewed. And then you're pretty much ready to go.
Car seat test.
Sure, yeah.
Yeah, they put the baby in a car seat, make sure that they can they're there for like 90 minutes or so, and then they're especially if they're born early, but they put the baby, make sure they're breathing okay, they're comfortable and ready to go. Yeah.
And then the only other difference is that for vaginal deliveries, the minimum stay is basically 24 hours. Get all these tests that need to be done at 24 hours done. And then for C-sections, the baby is not going to go home before you. So don't worry about that. And while you're admitted to the hospital recovering from the C-section, if that's the case, the baby is going to still be looked after by the nursery staff. So just a little extra time to, review the breastfeeding, double check the jaundice if there is any, get more, tips on anything that you have questions about. It's make sure you use all the resources you have there.
Lactation. There are many places that have lactation, especially if you're a big medical center. They have lactation services that
see them a couple times.
Yeah, they come around and they're great.
Right. And then you're ready to go. The pediatrician, it would be one of us if we were your pediatricians. What we would do is, go through the checklist of things, make sure everything's good from the exam that we had. Work with the nursing staff, and then have an appointment ready. It's always good to have an appointment ready with the pediatrician, outside of the hospital to make sure we're on the right track with everything. So I guess that brings us to one of our last couple questions is, what's it like being at home with a newborn for the first time?
I was nervous driving my baby the first day home.
Yeah, I can imagine.
Oh my gosh. Yeah. It's so unnerving bringing the car up,
every bump in the road.
Even putting the car seat.
Yeah.
Right.
Making sure it's secure,
making sure it's secure, making sure it's right, and baby's like head's not kinking, and having a wife who's like is sore.
Oh yeah, true.
It's very, 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 very tough for dads as well. But driving home, getting home, great stuff, and Yeah. So once you get home, you're by yourself, and it could be scary.
Yeah.
Especially if you're by yourself, you don't have your mom or your grandma or so some experienced women around you.
Yeah, and I think it's a real luxury, to have like that village built in, having family nearby, aunts, grandparents, people who are fortunate enough to be able to have like a night nanny, something like that.
Mm-hmm.
Definitely very, very fortunate to have.
Yeah. So the other stuff, I mean, babies don't do a lot.
They
right?
don't too much.
Yeah. So what do babies do? What you need to keep accounts of?
So basically, the things, there's so many apps these days, and for sure, a lot of them are really good. We don't have any that we particularly recommend, but people will track how many times the baby has peed, how many times the baby has pooped, how many times the baby has eaten, and how many minutes at the breast or milliliters of formula. You have to be a little bit familiar with milliliter to ounce conversions as you have a newborn. 30 milliliters in an ounce. Each little formula bottle is 2 ounces, so 60 milliliters.
Yeah.
And about roughly eight feeds a day. So anywhere from 8 to 16 ounces of milk per day.
Yeah. I think there's few things to pay attention to. I think bowel movements. I tell my patients that once you have one bowel movement the first day, that's it. Don't worry about it. Like the frequency, right?
Yeah.
There's a few things we look for bowel movements that you have this transition, right? That we know that like around that time you're getting enough fluids and nutrition that your poops need to be changing to a different color. Once they start transitioning to a different color from this tarry green black color,
meconium.
Yeah, meconium. Then we know it's good. The frequency really doesn't matter. Some babies poop like twice a feeding.
Yeah.
Well, some babies poop like once a day, maybe even longer.
Right.
There's like days sometimes go by. It depends what there's so many variables in it. Pee is important. Right?
Yeah. So with peas, what we count is we want one more pea per day of life for the first 7 or 8 days until they get there. Then if you're having 7 or 8 peas a day, you're good and you're well hydrated.
Minimum is 5, right? We're looking for minimum 5 for hydration, but that's after day 5, obviously. Yeah. So day 2 you could have 2, day 3 you could have 3. By 5th day you should have 5, and then it would be nice to get to 7, 8.
Yeah. Well, what we're also looking for though too is sometimes parents will look very, very carefully at the line on the diaper. And that can sometimes be a little double-edged because if they're having very, very slight urines, those little lines are very sensitive. It'll change, from yellow to blue very quickly for like a tiny drop of liquid. And so, you have to be careful that, the baby is actually taking enough.
Heavy diapers, yeah.
Right. We want to see nice, heavy diapers. They don't have to be the heaviest diapers every time.
Not at first, yeah.
But, that they're having some sizable urine. And that's why we do want a pediatrician visit within the first couple of days of life, just to make sure.
Yeah, I think if they're having those frequent visits, that he won't miss anything.
Yeah.
You're here every 2-3 days. We monitor. We let you know what's up.
And sometimes parents ask, well, we could just measure the baby at home. It's like, but do you really want to be doing that, measuring yourself and then weighing yourself with a baby while the baby's crying and you're crying? And
Don't do that. That's what I have the doctors for.
Yeah.
It's like you want to just be mom or dad. Right? Yeah, take care of your baby, love your baby, and then let us worry about the jaundice and the dehydration and how things are going.
Yeah, but the babies let us worry about how well the baby's feeding, and you just worry about getting the most comfortable latch and making sure that your nipples are comfortable and if you're using a formula, that your formula is you're making the formula the correct way.
Yeah, that's very important. We see people who sometimes mess up on the concentration. That's not good.
Yeah, just follow the recipe.
Attention. Yeah. Babies cry. I was saying, that's another thing, right? It's like they cry a lot.
Yeah, they don't have a whole lot of other ways to communicate, especially when they're first couple days of life. If they're happy, they cry. If they're sad, they cry. If they're hungry, they cry. If they have to poop or they already pooped, they're gonna cry. So it just in your head you're gonna have this mental checklist of the different reasons that they could cry, and you'll check the diaper. You'll see if they want to eat.
Cold, hot.
Right. You'll give them a hug. You'll rock them. Babies really respond very well to motion. They sleep nicely in the moving environments. So babies.
It's the snoo.
Right. Yeah. You all know the snoo. Yeah. Snoos are great. They do cause some flatness of the head.
Yeah.
We won't go into that.
Yeah, don't go into it now.
But the babies, you probably noticed when the baby's in the womb, they sleep so well during the day when you're up and about doing your daily stuff. And then when you're sleeping at night, that's when they start kicking in.
Yeah, that's the day-night flip.
Right.
Yeah.
So that's going to be a thing. You'll be like, why is my baby sleeping all day? Why won't it sleep at night? It should sleep at night. But just realize the reason why the baby is not sleeping at night is because they're in that Asia time zone. So don't fault the
what
baby.
happens in China? Are they
they're in the American time.
Yeah.
So if you just move to Asia, as soon as
the baby's born,
don't do that.
No travel.
No travel.
Yeah. They're flipped, and it takes 1 to 2 weeks.
Yeah.
And exposure to sunlight, indirect sunlight, no direct sunlight.
Right.
So you want through a window,
keep the lights on.
Yeah, something like that helps to adjust their day-night, circadian rhythm. Right?
Yeah. Circadian rhythm will really kick in around 3 or 4 weeks, but they'll get over their night and day by 1 or 2 weeks.
Yeah.
I guess that's kind of our last topic that we want to talk about was sleep, right?
What is the other thing that I know it happened with my wife too. It's like as moms, as soon as they come home, they're like, I gotta clean.
Oh.
All right.
I didn't know that.
It's like that's the thing. It's like before you have the baby, you have to have the nesting thing.
Okay.
You have to make sure that the home is all set up and everything. But since you've been at the hospital, the dad has been coming home and messing things up.
Oh no! Okay.
And then you come home and I gotta clean, it's great, but you have to be. It's okay to have a messy home for a bit. You need to take care of yourself.
Yeah.
It's like the airplane thing. You're supposed to put the oxygen on you first before you take care of the baby. Same thing with the mom. You need to take care of yourself. Right. In order for you to be able to take care of the baby. Yeah. So I think that's one of the biggest things that moms kind of forget. And dad's job is to take care of the mom. All right.
Absolutely.
Making sure that because she's by herself and she went through this whole huge thing, had labor, and then she's all these hormonal changes. Her body's changing. There's a lot of stuff. So we need to be helpful and. The moms need to understand that they have to take care of themselves, make sure they're okay in order to be able to take care of the baby. So it's okay to have a messy home a little bit.
Yeah, and definitely for both parents, and moms especially, taking care of yourselves is so important. We can't emphasize that enough. Yeah. Giving birth is really challenging. Having a newborn baby and being the mother of that baby or the father of that baby, the parents of that baby, it's very challenging. So being kind to yourself, there's so many huge changes in your lives at that time, with how much of attention needs to be put on the baby. Your day becomes, if you're fully taking care of the baby, it's to the baby's, eat, sleep, wake cycle. And that can often be very grueling of every 1.5 hours or every, if you're lucky, every 2 or 3 hours in between feedings. So getting enough sleep for yourself, maybe taking turns, taking some shifts, getting some help, don't be afraid to ask for help. Please ask for help as far as, getting people to help out with cleaning, getting food, nutrition for yourself is the best way that you can produce good milk.
Yeah.
So, making sure that you are well.
Yeah. I think for babies, sometimes it's complicated, but it's not, like I said, they don't do many stuff, right? They cry, they poop pee, they sleep.
But those little things that they do can be very annoying.
There's not much. And also what, parents worry about is like feeding. You want to make sure the baby's fed. You want to make sure the baby's warm because they don't have control over the temperatures for a while.
Right.
So, and the safety, right? So what are the safety stuff that you tell your parents?
Definitely. I mean, one of the most important things is that we want to make sure that any fever, so 100.4 or above, measured rectally so we can get a good core temperature, taken very seriously. Call your pediatrician immediately. Go to the emergency room immediately to be evaluated because in the first 30 days, babies are at high risk of newborn sepsis, and we address that very seriously.
Yeah. Sleeping, right? You want to make sure that they're in safe sleep environment. I think the biggest things I think in pediatrics is SIDS, right? Like we had, I don't know if you saw during your training, but
personally, no,
I probably would see 2 or 3 a year.
Wow.
Yeah. In the 3 years that I was there, and all of them were because one of the things that we tell people don't do. They were either they had something in the crib, or they were on their bellies, and so having a safe sleep environment for babies is really important. Making sure that they don't have anything in the crib and making sure that they're on their backs.
Right? Yeah, absolutely. Yeah. Well, with that, I mean, that's probably not the thing that we want to end with. Why don't you wrap it up with like what are like the other partners' role in this whole thing? What would you say after the baby comes home? What's the biggest thing for the other partner, the father, or people who are friends or family to support? What should they do to help out?
I think listen to mom. Look at mom. I think the best thing is to make sure that I think human beings we're very good we're empathic. So just like being with a person, you get to know what they need, right? They need help in their home. They need help with food. And sometimes they need to spend time with the baby. The mom needs to take care of herself as well. So those, I think.
Yeah, absolutely. Just providing, whatever comforts that you can for this, new mother, new parent, to help smoothen the journey.
Yeah.